with how to properly use a health savings account with Pat Jarrett from Health Savings Administrators. We might have a special call-in from another savings account company, Elliot Gorog, who will tell us about another account for the out-of-pockets currently. So it really is going to mesh well with our health strategy that I will outline tonight on the first part of this webinar, as we do each week. Jeff Cantor is out. He was just at Freedom Fest, and so I'm going to go through the strategy really quick here. But first, our coming guests next week, we'll have Dave Sleepak. So if you don't want a savings account with the sharing that we offer, we do have a really nice hand-holding service where for basically no copay and unlimited visits to the primary care doctor and chiropractor redirect, another partner of ours will give you that option. And Dave will discuss that next week. In 2 weeks, we have another direct primary care physician, Lee Heeb, out of the Midwest, Nebraska, and she will co-host along with David Demarest from Rose to Freedom, which promotes our healthy care strategy. And that'll be a nice evening to talk about a good partner for our strategy, which is the monthly fee of low-cost primary care physician, along with this member association that promotes us, because they like the idea of creating cash payers. In 3 weeks, we will have a friend of mine who is in the pioneering area of gut health. If you follow medicine, a lot of research now is looking at problems in our gut for where disease manifests first. And Tom Acklin will present the latest in that area. As we create cash payers, you learn how to shop around for options. So you want to know what is causing your ailment. So we do tend to go into these medical issues. Only a month from a software which offer you to find a well-priced specialist in your area is a Health Genie, and the inventor of that service, Dale Clemens, will co-host in a month from now. So this is the Cash Patient webinar, and I'm subbing tonight for Jeff Cantor. And our special guest tonight is Pat Jarrett. And let me just go through some slides here. And the screen that you're watching can help me unfreeze. That'll make it easier. So the theme of tonight is, with HSAs, invest them. Invest your balances, don't spend. And Pat Jarrett, who is on the line from Health Savings Administrators, will present that plan. Let's see if we can't unfreeze this. All right, let's try this once again. Maybe I'll just keep it this level so you can see the slides on this screen, so we don't have a problem with freezing. So the next slide, if it opens, we'll talk about our overall company. This is a day of technical difficulties. I love it. All right, I think it is thinking to open now. There we go. We're all about patient empowerment. We're not really here to take on Blue Cross as a better insurance. The members of our company really are idealists that want to bring together the best companies and techniques to really empower patients. And you know, my background as a lobbyist in DC with a bunch of health leaders has led me to conclude that you have to create cash-paying patients if you want to have empowerment. And that is the doctors who want to innovate. And just at Freedom Fest, Jeff Cantor was hanging out at the Free Market Doctors booth at AAPS. They're the ones who want cash payers so that they can innovate. And when you buy a better health plan, at least ours, you do help fix a broken market. And we do consider the seventh of the economy controlled by healthcare as a cartel, and we do aim to disrupt it through our cash payers as they disgorge prices, facilitate in a large measure helped by the health savings accounts that we'll present tonight. And for any questions or for a proper presentation from an agent, that website is where you go, yourfreedomhub.com. And this goes for families who are stuck overpaying for health care, or businesses looking for better benefits for the small group market, professionals in healthcare, whether doctors or others looking for cash payers to help them get more independent, or agents who want to enjoy our significant commissions for giving their customers better health care. And let's see if we can't bring this next slide up. I'm just trying to make this challenging for us. I just trying to read the present slide. Let's see if we can't get this up there. There we go. I want to go ahead and click the next slide just because it takes that long, it seems. So we really try to tackle what we see as 6 big problems with healthcare. First are the high and rising premiums. Second are the lack of incentives for patients to really engage with the system to make it better. Third, the reliance by insurance companies on networks of doctors that just deny you choice and lead to a conformity dominated by third parties that I don't think is healthy for medicine, which after all is an art, not just a science. The scattered nature of medical records, no one can really find the records from that hospital so many years ago. All the lost time finding the right specialist or venue for your accident. And finally, the fact that healthcare personalized as it could be. And we try to really address that with some of the artificial intelligence assessments that we can run your blood DNA and zip code environment through, give you a really individualized care system and recommendation that your doctors and naturopaths can help you work with. I have to leave this PowerPoint and go to our guest here fairly soon if this isn't going to work out too well with my slides. But what the next few slides basically show is that what we are selling isn't insurance or sharing, it's really a strategy. And that strategy will use whatever product or treatment we think gives you the most harm. And this visual kind of displays that. At the heart of it is medical cost sharing, which we do use for the expensive surgeries, the heart attacks, the accidents. We find that medical cost sharing is priced better and structured better than insurance. It's something over 1 million folks have started using instead of insurance. It is similar in dynamic to credit unions, which to the banks. It's hard really to tell the difference between the two. You have a monthly fee and a company paying the bills, but it is different. And basically the secret is in lack of shareholders. If you don't have shareholders to pay, you can drive profits back into benefits. On the lower left, you see accounts for expenses, whether in retirement or currently. And this is something we'll discuss tonight with the health savings accounts for retirement and HMAs for current expenses. And on the lower right, we don't just unleash you in the marketplace as a cash payer without any help. On your membership card is an 800 number that you call whenever you get sick or have an accident to be reminded of the process, because you won't remember it. Just call a concierge. They will hold your hand, help you shop for drugs, specialists, and tests, and they will be your guides in this new world of patient empowerment. Now we do have a number of ways to cut your out-of-pocket exposure if that slide comes up. But basically, the more you pay per month, lower out-of-pocket, which we call the initial insured amount you can have per sickness or accident. If you want to, and there you see it, you can pay $5,000 of any sickness or accident before we come into play with the sharing. Or if you want to pay more per month, you can have us come in whenever a sickness or accident reaches $500. So it's up to you how much you want to pay per month. If in number two, you can't really budget a lot of money per month and you want to pay less and you want to have a higher out-of-pocket or initial insured amount, then we recommend setting aside additional tax-free money with an HSA or an HMA to protect you in that scenario. Some of our screenings are free. Teledoc is free, and our concierge will shop your drugs internationally for generics to deliver to your door. Standalone testing centers or specialists are cheaper than both in the hospital. And if you do anticipate more drug costs or primary or doctor visits over the coming year, you may want to forego the savings accounts and go with a direct primary care physician who can give you free or low-cost basic care for a monthly fee, or we can find you a doctor for zero copay through our redirect option. And we do call ourselves a healthcare strategy, starting with avoiding healthcare costs from using our assessment of your blood, DNA, and environment to help you be a person responsible patient. Then we have some preventive services which are free. Then we want you to manage your costs with a savings account of some type or a direct primary care physician. And we want you to consolidate all those records in our QR code vault on your membership card. That is great. Your doctor sees all your records in one place. Emergency personnel will find you unconscious from an accident and be able to tell what your allergies are or what your prescriptions are to avoid hurting you, which is really nice. Our fourth strategy is mitigates. Whenever you do have a sickness or accident, some episode, our concierge number on your card is there to help you shop for drugs, tests, and specialists using our software Health Genie if you can. Really a good shopper. Help you find that specialist in your price range. Medical tourism is a great opportunity for you when you're a cash payer. And we do require you to use our second opinion service for new recommendations for surgery to make sure they are warranted, that there's a process involved there so you get what you want and need. Finally, contain. When things get expensive, we use sharing, not insurance. And there are some limits to this strategy. We do make you wait on any pre-existing condition for a year. So if you're on cancer meds, we're not for you. If on the other hand you have some other pre-existing conditions which you don't think will be too expensive, join us. We don't say no to anybody. We just want you to know up front if it gets expensive in that first year, we will help you with our concierge shopper, and you will have the HSA or HMA to help you pay for it on a tax-favored basis. But you are paying for it on your own. That is a limit. If you're a smoker, we'll surcharge you and limit our sharing for diseases caused by smoking, although we have that artificial intelligence assessment to help you quit. We do stop paying for your drugs 4 months after you're cured, but we will help you find cheap overseas and give you a tax write-off through the HSA or HMA. And be advised that when we say out of pocket, it is not a deductible that resets annually, which is different from insurance. It's per episode. We come into play only when your sickness or accident exceeds that initial insured amount, that threshold that you choose. It could be as low as 500. It could be as high as 5,000. But we will not make you pay for new episodes after you've had 3 per year or 5 for a family, which could multiply into a hefty amount. But think of this, how realistic is it that you'll have cancer, a heart attack, and a car accident in the same year? Not likely. only single-digit likelihood. But, and, if you're really sick, chances are it's going to last more than a year. No matter how many years your disease remains, you're only paying your initial insurance amount, 500 to 5,000. After that, you're done. We pay everything above that. So those are the limits. We want you to join us with your eyes wide open and not really be under any misimpression. We do have a lot of big groups promoting us because they want the same cash paying revolution that we're providing. Health groups like the National Health Federation, trade associations like the Professional Appraisers, activist groups like the Republican Liberty Caucus, and pioneers in direct primary care like Dr. Ray Cordenoy. For any questions, just click yourfreedomhub.com and we will get you situated with an agent to get you educated and enrolled. So we're going to turn it over to Pat Jarrett, and if in the end you do want to have an investable HSA, that is our link, ID and password to get yourself one, and that's the link for the HMA right below there. And we'll return to that at the end, but now let me turn this event over to Pat Jarrett. Let me just do a quick, there we go, make presenter. Okay, Pat, yes, you should have a window pop open, Pat, to accept the presenter's role. If you see that, Pat.
Yes, you did.
Do.
Yeah.
Perfect.
All
You're
right.
on.
We're on. Okay, we've cleared that technology hurdle. Thank you, Charlie. All right. Hey, you've done a great job of kind of setting up where I want to go tonight. This discussion about health savings accounts, and what I'd like to do is kind of start off by putting a bit of an exclamation point behind what you've said already about healthcare costs, and then look at why HSAs, health savings accounts, are one of the best options for addressing personal health care finances. So let me get to the next slide here. All right. So what you see here, this little thing that the feds put out, and basically, according to a study from Willis Towers Watson, what we've seen over the last 35 years is that healthcare costs have risen at somewhere in the neighborhood of 6% a year, or about double what the general consumer price index is. And if you look at this, you see the red line there is the consumer price index for all items. So that's your loaf of bread and your gallon of milk and your gallon of gas. And you can see that the blue line there was tracking along quite nicely with it until about 1980, when all of a sudden it decided to take its own path. And from that point forward, it's essentially been twice the consumer price index. So while that loaf of bread has gone up a little bit, that prescription has gone up a whole bunch. And what this means to the average individual is that money that they were putting aside for retirement, or for that trip with the grandkids, or that 50th wedding anniversary celebration, is going to get eaten up by healthcare expenses if they don't have some other way to pay for it. And where, oh, whoops, accidentally ended up, there we go. Okay, so most people are scared to death by this, and in reality, their fears are somewhat warranted. Every year, Fidelity puts out a study that says how much is the average couple going to have to pay above and beyond Medicare for medical expenses in retirement. And this year, actually 2018, it was $280,000. Now it's up to $286,000, and that's above and beyond what Medicare is paying for. And for those of you in the listening audience who think, well, that's fine, but I'm healthy as a horse, the problem here is that much of this $280,000 are premiums for things like Medicare, long-term care, and things that the longer you live, the more you'll actually pay. So being healthy in this particular case is not necessarily the blessing that we would hope that it would be. The other issue here is that this $280,000 doesn't include some things like over-the-counter medication, dental services, long-term care expenses. So I've seen other studies that put this number closer to $400,000. The point being here is that there's a big chunk of expenses that are going to hit most of us when we get to retirement age, and we've got to have a way to pay for those. So let's take that $286,000 that I talked about a minute ago. If you can pay that with tax-free dollars, then that $286,000 bill is going to cost you just that, $286,000. But if you've got to pull that money out of your 401k, then to pay that $286,000 is actually going to cost you something more like $380,000, because you're going to have to pay the taxes on it. So that's about a $90,000 hit on your tax bill. Oops, wrong way. There we go. All right, so let me talk briefly about how a health savings account, or an HSA, helps to address this. And I want to just give you a quick overview of that quick overview of the benefits of a health savings account. Sorry about that. Number one, money in an HSA is contributed and is tax deductible. And because it's an above the line tax deduction, it's available to pretty much everybody, no matter what your income happens to be. While that money is in your HSA and not being used, it can earn interest, it can be invested and have dividends or market growth, and those earnings and interest are tax deferred. In other words, you don't pay any taxes on those while the money sits there. And thirdly, when you pull that money out for medical expenses for yourself, your spouse, or your tax dependents, that money comes out tax-free. So it's a dollar you could earn, put aside, invest, reap the benefits of, and then spend it and never pay any taxes on that dollar that you earned. And there's one extra tax benefit that a lot of people don't talk about, and that is, should you decide to make your contributions through a Section 125 plan at your employer, or a cafeteria plan as it's often known, that money goes in pre-tax. In other words, it doesn't even show up on your paycheck. The beauty of that is that both you and your employer save the FICA tax on it. So that's another 7.65% that each of you save just by the way you contribute that money to the account. All right. Now, as good as an HSA is from a tax perspective, there are two ways to make it better. First of all, invest that money while it's sitting in your HSA. So take that money that's sitting there and put it in a mutual fund. Put it in something other than a bank account that's earning you 1/4 to 0.5%. The second way is to pay your medical expenses out of pocket. And that's why we've got this picture of the shoebox here. Shoebox those receipts. If you can, pay your medical expenses out of pocket. The IRS does not require you to pull that money out of your HSA in the same tax year that you had the medical event. So that allows you to put that money in there, pay your medical bills, let that money sit for 5 months or 5 years or 25 years. Meanwhile, reap the benefits of that money sitting in there invested, and then use it in retirement to either reimburse yourself for those past medical expenses or to pay for those medical expenses that we talked about a few minutes ago in retirement. And like any good investment, time here is your friend. But what I want to show you here is that if we were to take the contributions to your HSA, which are limited by the IRS every year. For an individual, it's about $3,500 this year and about $7,000 for a family or anybody that has 2 or more people on their insurance policy. So those aren't big numbers, but when you compound that over time, you can see that even a 50-year-old would be able to get dangerously close to that $280,000 number that I talked about earlier, and a 30-year-old would be in deep clover, as they say, if they were to fully fund their HSA every year and pay for those expenses out of pocket. Now, I'm not so naive to think that everybody has the opportunity to do that, but this just shows you how over time even modest investments can turn into some pretty good numbers. Probably not news to most of the listeners here, but it bears, it's worth repeating. All right. So the thing that we've found in the 15 years that we've been doing HSAs is that education is sorely lacking. You know, about 80% of people consider medical costs to be one of their biggest challenges, but only 8% of folks are actually saving in their HSA to do that. So what we don't want to try to do tonight is address that number one obstacle by giving you guys a little bit of education about health savings accounts and increase your awareness and your understanding. The other piece here that was surprising to me that we've seen over the last several years as we talk to a lot of financial advisors is that a lot of employers would like to talk to their financial about tax savings and HSAs, but the advisors that we talk to are no more informed than many of the consumers and employers that we talk to. So there is a job for us to do out there in educating everybody. So Charlie making this available was quite helpful. So I want to talk a little bit about health savings, and I think by talking about our company and our mission, you get a kind of sense of what our advice to you would be. So at Health Savings Administrators, we're on a mission to help our employers, our customers, and our partners deal with life's changing health and financial needs. We include employees because we believe that if we take care of our employees, they take care of our customers. And what we've done is try to design an HSA that allows you to change your saving and investing mode as your financial and medical needs change throughout your lifetime. So we've also included some investment-focused products and services because this allows for more flexibility, again, as your financial and medical needs change. We've been doing this since 2004. We were actually in the MSA business as far back as 1997. HSAs were created on January 1 of 2004. President Bush signed those into effect in December of 03. And so we became Health Savings Administrators, one of 16 people in the country doing that on January 1 of 04. We're not a bank, we're a non-bank custodian. And so we have always looked at these as part of a retirement plan. And because of that, we've always allowed first dollar investing for all of your funds. Many banks require you to hold $1,000 or $2,000 in cash before you can even talk to the investment side of the house. We think that just like a 401k, while not everybody can contribute the max to it, everybody should be putting a little bit aside. So we try to reduce those hurdles to getting to the investment side of the house. And we've made it easy to move back and forth between the saving, the spending, and the investment side. We've put together a selection of low-cost institutional grade funds. And what this means is these are funds with extremely low expense ratios. Our average expense ratio for the mutual funds we offer is 16 basis points. Industry-wide, you'll see that the average expense ratio is 64 basis points. And for those of you who don't know what a basis point is, 100 basis points is 1%. So 64 basis points is 2/3 of a percent. It doesn't sound like a lot, but when you compound that over 20 years and maybe $100,000, all of a sudden it turns into real money. So what we've done is put together a platform that allows for the most inexpensive investing that you can find, similar to what you would see if you are a retirement plan coming to look for mutual funds. And then for those advisors out there, we do have an open architecture fund option and actually an advisor-specific portal if, in fact, you're in that situation and you'd like to work with us. By approaching HSAs differently, by making them part of a comprehensive retirement plan and telling the story differently, we have seen drastically different results. Our average balance is 5 times higher than the industry average at $10,000. That's the average balance for us versus about $2,100 industry-wide. So that's where the banks and the other HSA providers land. Now, we've got four times more investment assets than the average HSA out there. Industry-wide, 20% of HSA are invested. For us, it's 87% are invested. Again, tell the story differently, get a different result, give people different opportunities, and they behave differently. And that's basically what Charlie was talking about earlier today, trying to give you different opportunities to help you change your behavior to help you fare better in the marketplace. And finally, we've got over $800 million in assets, and much more of that is staying in year over year, where the average retained contribution is 24% nationwide. We're keeping almost 40% every year. So our customers are learning how to shop better, how to save better, and how to invest better. We currently work with about 1,500 groups nationwide, and those include everything from some mom and pops, some small medical practices, architectural firms, tech firms, up to some pretty large players. Dimensional Funds, who happens to be one of our fund families, is also one of our clients. We started out with 2 employees back in 2004. We're at 54 employees now, and as I mentioned earlier, approaching $900 million in assets, and we are ranked among the top 20 HSAs nationwide. And currently there's about 2,200 banks and credit unions offering HSAs. So we're proud to be in the top 20 there. We do believe that education is the key, just like this webinar here. So we've put together a variety of webinars, portal demos, brochures. We do on-site training for some of our larger clients and some of our Virginia-based clients. Email campaigns, any way we can figure to get that message out. We don't rely on one methodology to do that, but try to hit people wherever they might happen to be, and basically drip on them almost constantly to get them to act in their own best interest. I mentioned we've got inexpensive funds. Our fund ratios are about 55% lower than the industry average. In addition to that, we've got no investment trading fees, so there's not a $5 per transaction fee or anything like that. And our first dollar investing then removes that opportunity cost of, if you've got $2,000 sitting in a checking account earning 0.5%, but you could be earning 10% in the market, you've got a 9.5% opportunity cost, or about $180 a year that you're losing because that money can't be invested. First dollar investing removes that and gives you the opportunity to make the most of every nickel that you've got in your HSA. Our customer portal, one of the things that makes us different and we believe is important to being able to be flexible is having one single portal. You log into it, you can see what's on your debit card if you have a debit card, you can see what's in your investments if you have those, you can move money easily back and forth between the two. So you think of your HSA as one entity, not like I've got my cash debit card and oh, by the way, yeah, I've got this investment thing that I never think about. We also offer seamless access to the Morningstar fund data so that you can look these over by yourself, direct them. They are self-directed, but it gives you access to the information you need to make an informed decision about where you want to put your money and how you want to move it around. And last but not least, we've done a good enough job that that a variety of folks have taken notice and have acknowledged us for that. Plan Sponsor Council of America just gave us one of their signature awards. Pension Investments gave us an award, an Eddie Award, for the educational practices that we've rolled out. Kiplinger's has named us twice in the last several years as Best HSA for Investors. So we're proud to say that other people have taken notice of the different story and the different results that we've been getting. And with that, I'll stop and take any questions that that Charlie may have or that any of you might send in.
Thank you, Pat. And for the attendees, as I unmute you, just by your window on the upper right, where you see that green button, that means you're unmuted, and click it until it's red to mute yourself if there's some noise. But right below that is a raise hand option. So to keep things orderly, just click that raise hand option and I'll call on you. And let me just finish unmuting everyone. Again, if you have some background noise, do us a favor and mute yourself. Uh, Otherwise, I'll have to mute you. So I'll start off as folks think of questions to ask, and click that raise hand icon, Pat. Um, most of us that offer HSAs, because we offer a high deductible minimal essential coverage piece as part of our strategy to make us compliant with the Affordable Care Act, default to a certain bank without putting too much thought in it. So we're looking for low cost for our patients to make sure it's affordable to build into our strategy. Some of them do, like you say, have balance amounts that you have to maintain before you can invest those funds. What would they say in rebuttal to your innovation? You have, first dollar investing. It's a low cost investing option. On the other hand, so what would they say, and then how would you answer their concern?
Well, the typical approach for that is that, well, we want to make sure that people have enough money in their account to cover their deductible. And that's legitimate for many, many HSA owners, because a lot of these folks are living, paycheck to paycheck or month to month, however you want to characterize that. And that's why we have a debit card available so that people can put money in there. And if they want to have that nest egg, or if they can't afford to pay out of pocket and invest that money right now, that's why we have a debit card. So my response to that is that's a legitimate concern for a given percentage of the people, but why not just let them choose versus you make the choice for them so that you hold their cash? Because here's what happens. We're human beings. We get in a habit. We put the money in a checking account, in the cash. And if there's a hurdle we have to clear or something different we have to do to move it to the investment, the odds are that we're going to forget about that. We're going to set this thing and forget it. And I'm as guilty as anybody else as far as that goes. So why not be able to set that up right off the bat so that 10% of it goes into your investment? That way, if you need it, you can pull it over. So my point here is let the consumer make the choice based on their particular financial and medical needs at that moment in time, versus force them into something that's probably going to create a habit that they're going to have a difficult time breaking.
That's wonderful, and thanks for that. And just real quick, as I show folks my screen again, these are the two links that are going to be popping up in a second for those who want to go ahead and get Pat's investable HSA. And as my slide comes up, the website is pretty easy. It's yourfreedomhub.com/HSA. And there you see it on the screen. /HMA if you want to double your money for an out-of-pocket account. So these two accounts complement each other perfectly. You set aside money to invest for retirement, which the HSA, I mean, folks, you have to have seen the Motley Fool and Yahoo Finance articles saying, right, Pat, the HSA for retirement is better than an IRA.
Correct. Yeah.
That's that real quick. So how do you, when folks' eyes pop open when they hear that, tell us, why is an HSA better than an IRA for retirement?
Well, that's a great question, Charlie. So if you think about it for just a minute, so what you've got here is your HSA dollars can sit and be invested just like your IRA. The IRA, though, when you pull that money out, you pay taxes on it, correct? The HSA, if you pull the HSA out for medical expenses, you don't pay taxes on it. If you pull it out for non-medical expenses after age 65, you only pay your prevailing rate. So what you've got is an IRA on steroids when you've got a health savings account. Now, if you can afford to fund both, then there's no reason not to. But if you have to pick and choose, and we would even argue that an HSA, unless you're getting employer match, is a better deal than a 401k. And again, it's because you can use it tax-free for health or taxable for non-health. But your 401k, as I showed you on one of those early slides, you pull that out for healthcare, you're going to pay taxes on it. It might be 20% or 15%, but you're still going to pay taxes on that money before you can pay that medical bill.
That, Pat, is such a fascinating conversation and creates such cognitive dissonance with, we're marketing it now. This is, retirement part of your health plan. The articles are out also about all the surprise out of pocket when you retire, especially if you're healthy, because you're going to live longer and you're going to have those home health or long-term care expenses. So I think this is just the beginning of the conversation about the critical need to have an HSA as part of your and retirement planning.
Yep.
David, if you want to unmute yourself, I see your hand is up.
It's David Demers with Roads to Freedom. I have two questions. One, are there any limitations on how you invest your HSA savings? And secondly, what happens to your HSA savings if you die? Are the funds transferable?
Yeah, good. Great questions, David. Thank you. There are essentially no limits on what you can invest. You cannot invest, however, in insurance vehicles. So basically anything like mutual funds, anything that you can put in an IRA would be fair game for your health savings accounts. Most people and most HSAs that have an investment vehicle use mutual funds. Now, having said that, I want to make sure you don't go down a path that would cause some problems, and that is you can't just go down to your local bank, or you can't call your broker and say, hey, I want to open my own HSA and designate an account that you own as an HSA. It must go through an approved HSA custodian because there's specific tax reporting issues around that. So I just want to caution you, don't think like, hey, I can invest in antique cars and that will be my HSA. You can't do that. So second question, what happens at death? And that's an excellent question. If your beneficiary for your health savings account is your spouse, then your HSA transfers fully as an HSA to your spouse, even if they're not eligible to contribute to that. So they could be on Medicare, your HSA transfers over to them. They can use all of those dollars tax-free to pay any residual medical bills you may have and any ongoing medical bills that they have or that your tax dependents may have even after your death. So all the tax wrappings are still intact when you die. The only limitation might be if your spouse does not have an insurance plan that allows them to contribute, they might not be able to make any further contributions. One last thing on the death. If it goes to anybody else, if it doesn't go to your spouse, if you leave it to your children, to your neighbor, to whomever, then it's just part of your estate and it becomes money just like anything else you have. And it's subject to, if you have enough money stored aside, it's subject to whatever taxes estate inheritance might be subject to.
Okay, thank you, Pat.
Sure.
Excellent questions indeed. Eric Eckert, if you're willing to add to anything Pat has said about folks contacting your company, I have unmuted you. Eric, do you want to be on the spot here and say something or add to what your colleague Pat has said?
Yeah. No, Pat, you've done a fabulous job this evening. I appreciate it. So yeah, way to put me on the spot there. No, yeah, we try to make this at least from our standpoint as a company, a very approachable HSA. You can't harp enough and focus enough on the first dollar investing, no trading fees. As an individual or say an employee of a company, if you can only set aside a few dollars to your HSA every paycheck, and we have no minimum thresholds in our accounts either. So again, we try to make this as very approachable and easy to get into as possible.
And Eric or Pat, for someone that's kind of starting to be successful, they're not really, full of self-confidence yet, but they do want to start to save. to get that 100 grand by the time they retire. So they're in their 30s or 40s. What amount per month are you suggesting they set aside for the HSA? I know you can put 3 grand a year as a single, 6 grand as a couple, a family. What are you kind of helping folks decide? You're trying to budget monthly. What is that range you're thinking of?
Well, you laid it out there pretty well, although currently, and these numbers are indexed, so they change every year, but currently you can put 3,500 in if you have single coverage, and 7,000 if you've got family coverage, and if you're 55 or older, you can put an extra $1,000 in on top of that. You know, and that translates roughly to $300 a month or $600 a month. This is the max you can put in. The nice thing about an HSA is it's not like a 401k or like an FSA. You know, if you commit to $100 a month on your FSA, they're going to take $100 a month out, whether your car breaks down or your kid needs braces or whatever. With an HSA, you can modify that on a month-to-month basis. So let's say that right now it's summer and you're sending the kids to camp and seems like everything in the house needs to be repaired. So you can only put a couple $100 in there. But come November, you get a bonus and you got a couple extra bucks there. You can actually then ramp it up to max out, or just ramp it up to get more in. So the nice thing about an HSA is as your financial situation changes, you can change your dollar amounts. And the other beauty is you've got all the way until April 15th of next year to fund this year. So it's about as flexible as one could imagine. So we obviously encourage people, put away what you can afford, but don't kill yourself. You know, I mean, you know, if you have to change what you put in, the IRS allows you to do that and allows you to go to your employer and say, hey, change my HSA contribution from 300 down to 150.
Yeah,
Outstanding. Go ahead, Eric.
For folks listening on the call as well, and we'll get some links to our calculators, but we have a couple of different calculators on our website, so you can plug in some data, some real life situation data that you may have as far as the plan you're currently covered by, possibly how much you already have in your HSA, some goals and things you can set aside for each year, and you can kind of see how that'll build up over time. So it'll give you kind of an idea of what to shoot for and some goals. So if you kind of want to play around with that, we have some, you know, again, some calculators on our website.
That's great. And the next two folks I'm going to put on the spot are Dr. Tinsley and Jeff Ellington. If you don't mind me unmuting you, Jeff, my question for you is, as you brainstorm and wheel and deal with all these large businesses and large health innovators in a large group space, where is your mind at now with the idea of HSAs? And you have yourself self-muted, Jeff, if you're actually paying attention. Love to have your thoughts on HSAs as you've kind of really innovated and disrupted the market. Jeff, so if you want to unmute yourself, feel free to chime in. And Dr. Tinsley, as you recruit patients in the Southeast Virginia area for your direct primary care practice, which is taking off across the nation.
Let me close the door.
But you know, Trump, James, I finally saw Trump's order to allow HSA withdrawals for DPCs, and it has to be implemented by regulation. But given the proliferation of high deductible HSA plans everywhere, what potential does that have for your kind of DPC practice?
Did you want me to go first?
Yeah, James, go ahead. Dr. Tinsley.
Okay, yeah. It's got a great potential for the DPC practice. I mean, if they've got a pre-tax or another type of vehicle like an HMA to pay for it, that's going to make them more likely to do something like DPC.
And tell some of the newbies, you know, you're kind of new in the market. What do patients get out of that monthly fee and free or low-cost primary care? Why DPC?
Well, family doctors can see and treat about 80% of the problems that walk through the door. So we can we can cut down a lot of the things. We can do a lot of the stuff the specialists do. once they get stabilized, especially. So, and even treat a lot of the things they treat. So we can provide 24 to 48 hour appointments, so we can cut down ER visits. We can keep people out of the hospitals with those. We can give 30 to 60 minutes a visit. So I think we can provide better care than with a 10-minute visit. Also keeping people out of the hospital and out of the ERs. And they get unlimited visits without a copay, which is another great value for the patients, which means they're more likely, if they're sick, to come in than stay home and wait it out and end up in the ER or the hospital.
And if folks want to hear about DPC from you, or if there's any in their area, what is your website again, Dr. Tinsley?
LighthouseDPC.com, and I'm in the Newport News, Virginia area. But yeah, we also do handle minor emergencies. I can't take out your gallbladder or your appendix, so you need insurance for that. But yeah, you cut your finger, come in, we sew you up, you leave, no charge for my services. You just pay for the suturing material and the lidocaine. I can also do minor skin procedures. So I've got a guy that's going to come in, I'll freeze his warts, he'll leave, no charge. So there's a lot of advantages. I mean, we'll really cut down the cost of healthcare. And I'll just tell you, I saw a post on one of our websites where this other DPC provider was at a BNI, and a health insurance person tried to say that she had conflict of interest with him and that she couldn't present her product there at the BNI because she was cutting into the business.
Well, Dr. Tinsley, may I suggest that you invite your BNI group to replace her with me?
No, apparently they're arguing about it this week. So, and I think we will, and I think the insurance salesman is right. We will cut into their business because we're going to bring those prices down where they should be.
Exactly. And Pat and Eric, Dr. Tinsley, you were telling me there's a huge DPC practice in Richmond, and I'm in Williamsburg, so I think we're all Virginians here. We should all go have lunch.
Well, yeah, I'm not sure, but I don't know how big she is, but she's full and has a waiting list. It says on her webpage, and I don't know why somebody else hasn't opened up one up there.
And there's a standalone surgical center in Charlottesville. So we are the future of healthcare. Just like that image I saw earlier, sharing, just like credit unions, are taking on the big boys. It's a better deal for the expensive stuff. The savings accounts are there to become an empowered patient to shop around. DPC is a great deal for the family and the retiree, right, James? And then the concierge that holds your hand as you shop around. Who else wants to chime in here? We have a couple of minutes left. Some of you have yourself self-muted, so unmute yourself and fire away. We only have a couple minutes, so get your questions asked of Pat and Eric now with the investable HSA, the key vehicle for your retirement. Who else wants to blurt out a question or comment? CJ, do you want to brave yourself and have a little comment about your QR code before we hang up? You're marked as a. Go ahead, CJ.
Thank you. Once again, this has been a fascinating Wednesday evening. I really appreciate learning about everything that goes with what we do, which is very simple, as you know, helping people collect their records and store it and share it back with your DPC, your family, those people who need it. But fascinating, Patrick, in terms of what you can do with these investment dollars over time and through retirement. So thank you for bringing this out.
And CJ, to put you on the spot, didn't you have a previous life at the Federal Reserve, so you know a bit about the power of compound interest and investing?
It doesn't take much to grow. So this is wonderful.
That's great. Jeff, there you are, Ellington. If you want to, let me unmute you. You're self-muted, Jeff. If you want to click that green button up there, and then you can go ahead and ask your final question of the night. So I have you unmuted, Jeff Ellington, but you have to click that green button, red button for you, into green to unmute yourself. You have yourself self-muted. So One last chance, Jeff. If you can unmute yourself, you can ask your question. Otherwise, Pat, I'm going to allow you to close here. This is our website to get signed up through Health Savings Administrators, yourfreedomhub.com/HSA. You just go there and read up on it, and you'll be prompted to input an ID and password.
Well, Charlie, thank you for the opportunity. Thanks to all of your listeners for what were great questions that helped expand. Those are the things that actually make it all worthwhile for me. And Eric and I have both enjoyed this opportunity to learn about what you guys do, and also to spread the gospel of health savings accounts. So thanks again for a fantastic opportunity.
You're welcome, Pat, and thank you for joining us. Just real quick, coming up over the next few weeks, if you don't want to have an account, or you can have an HMA with us, but not the HSA, Pat, it's limited by the requirement to have a high deductible plan attached to it, which is unfortunate. It'd be nice to have a bit more flexibility under the law. But politicians and their controllers among the cronies will pass their competitors. But Dave Sleepak from Redirect will join us next week to talk about free unlimited visits with your doctor or chiropractor to triage you when you got a problem. And then in 2 weeks, we have Dave Demarest from Roads to Freedom, who is on the call tonight, along with Dr. Lee Heeb, who is a DPC in the Midwest. She also removes tattoos, which I gather is a growing business. And then we have, Dale Clemens, who runs our Health Genie software. Basically, you input your symptoms, it lists what you probably have, and then it pulls up automatically specialists in your area for that diagnosis based on price ranges to help you find a specialist in your budget. So it's another hand-holding service as we make you into a cash payer. So come back every week, 7 Eastern, and we are going to empower you as a cash payer and really bring high-quality medical choices to you. So thanks, everyone. Have a great evening, and see you next week.
Thank you. Bye.
Good night.